We are today here as part of a series that Transition Living Network and Anything Libraries has put together. So we've had a year-long series of events, and we have 2025 already planned out. So today, obviously I'll talk a little bit, Kelsey will be talking about Medicare, but I'd like to introduce the Transition Living team. So it's just a group of professionals that we all work with the senior population, and we've come together to put together these events to bring resources to you and the seniors in the community. So look forward to the November event, and it's going to be, I had the date here, now I forgot it. So the November date will be November 13th, and we're gonna have a lady who's gonna be talking about the holidays, the stress and depression during the holidays and ways to handle that. So it'll be a great presentation. I also wanted to note too that the last few of our series events, thanks to the library, are being recorded, and they'll be on the Anything Library website. So if there's anything that you missed today as part of the presentation, you can go back and watch. Or if there's somebody you know that should have been here, please let them know that they can go back and watch it through the Anything Library website. So first of all, for our Transition Living team, we have Cara Riley with Brokers Guild. She's a realtor. And Sherry Cree, who's also a realtor who works with the group. Kimberly Diaz with Care Matters. Kimberly's an RN and handles everything transition for seniors, whatever that might look like. And then Kelsey Mackley, who is part of the Transition Living team, who's going to be presenting today. And then myself, I'm Renata Anderson. I'm with Fairway Independent Mortgage. I'm a retirement mortgage specialist. So again, welcome, and please look for our events coming up over the next year here. I wanted to also recognize Heather Reed. She is our snack sponsor today, so you can thank her for all the lovely goodies there. And Heather, did you want to talk a little bit about what you do?
Sure. So I'm a mobile notary. Just so you all know, you can take your forms, most of them, to your bank. You don't need to hire anyone to notarize your documents. The reason to use a mobile notary like me, because you do have to pay a trip fee usually for a mobile notary, is if you're in a hospital, in a rehab situation, it's just not convenient to get to the bank. But I'm gonna caution you, before you go to your bank, call your bank, find out exactly which forms they're willing to notarize. Occasionally, they won't notarize wills or something like that. Make sure that they'll notarize that for you before you go. Make sure you set an appointment with them, because virtually every bank is requiring an appointment to do this now. And make sure that when you set that appointment, they understand that you want their notary. Because sometimes you'll show up and find out that the notary is on lunch, even though you needed specifically the notary. So, all of that said, if you ever need a mobile notary, especially for the documents that your bank won't do for free, I charge a trip fee, and that's it. So I can handle as many documents as you've got in one trip. Sometimes your bank will limit you. It's usually like 10 documents. So unless you are notarizing an entire trust package, your bank will probably do it for you for free. But if you ever need me, I am in this general area, and I can give you my phone number if you're ever interested. Thanks so much.
Do you have cards or information on the desk back there with you?
You would think I would have remembered them, but of all days, today's the day I forgot them.
So watch for the update on our website, the Transition Living Network website, or the Facebook page rather, and we'll make sure to post Heather's
Just tell your
contact
phone number
information.
quickly for people who want to write
Sure.
it down.
Anybody who wants my phone number, it's 303.
Just a minute,
I understand.
Okay.
Maybe we can try down the link.
Oh, yeah. Oh, there we go. And if you choose to save me in your phone, this is how I tell everybody to put my last name in. That way you can find me.
Now we're gonna hear from Kelsey Mackley with Kelmeg and Associates. Kelsey, I've known her for many years now. She is a Medicare specialist and a health insurance broker. She's very knowledgeable. We were just talking, you know, I've been hearing there's a lot of changes with Medicare, so I think this is a great time to be here and to get the information you need before open enrollment starts. But Kelsey has been in the business for over 24 years. She lives here, has lived here her whole life, right? You're a native?
Just about,
Okay.
since I was 7.
Okay,
Close enough.
yeah. And she has 2 boys and 4 big dogs, yes. So they keep her very busy. So we welcome Kelsey, and I know you'll get some really good information, and feel free to stick around if you have any additional questions afterwards. So, Kelsey, thank you.
Hi everyone, I'm Kelsey with Kelmeg Associates. So I'm going to do a little bit of speaking, have you watch a video, and then I'll go into more depth about Medicare. I went to school, I got my psychology degree at UNC. Started my master's at Regis, got almost all the way through, and then found out I was pregnant. And throughout this time, I had slowly started doing my insurance when I first started out. And that was about 24 years ago. We have the Lafayette, Colorado Open Enrollment Center for Connect for Health, and that's for anyone under 65. So I can help, spouses that say aren't at Medicare age, I can help them get coverage as well. We have 2 kids, Memphis and Maverick. I'll show you pictures of them here in a second. Memphis is in 8th grade on the right, Maverick's on the left. Very much into sports. Memphis is, Maverick is my smarty pants, loves to read, and he's really into archery. These are some of the dogs that I was talking about. So these girls on the right are they're called St. Bernese. They're half Bernese Mountain Dog, half St. Bernard, so they're gigantic. They are sisters. I was not supposed to have both, but lo and behold, that's what happened. And then Jupiter is my 7-year-old Mastiff on the right. Here on the, sorry, on your left. Yeah, they're sweet dogs, but man, they're big.
What does it cost to feed those 3?
Well, luckily at Costco, I can get it for, I think I go through 2.5 like 50-pound bags a month. So it's not terrible price-wise, but Costco, like, if you get the Kirkland brand, you can usually get a great brand and not pay the crazy price for it. But yeah, they are busy.
Do you have a big yard?
We do. These dogs, believe it or not, they would do great in apartments. They just want to be inside, the air conditioning, the couch.
Wow.
Yeah, surprisingly, I bet you would. Like a Chihuahua would probably be busier than these guys are, to be honest. So this is who all I can help with insurance. Obviously Medicare, it's anyone over 65 or anyone that's underage disabled. So what this means is if you know someone that's been disabled, and once they receive that 25th disability check, that's when they can actually get access to Medicare as well. So they don't have to be 65. And there are certain conditions that also can allow Medicare before 65, plus individual and family coverage through Connect for Health. Like I said earlier, this is for anyone under 65. I can help business owners down to 1 employee. I can help small group employee benefits from 2 to 100, and then travel health insurance while traveling internationally. And I'll touch more on this as the presentation goes on, because this is a very big benefit for Medicare that a lot of people are unaware of that is lacking if you are traveling outside the United States. So my process and why it worked with me. My philosophy is I teach each and every one of my clients as if they're my grandparents. I give you my full compassion, I do the research. How it works with me is I get all the details from your prescriptions, your physicians, your needs, whether they be current or what you're predicting for the future, and then we come up with a good plan to find a plan that's going to fit your needs and actually benefit you for the next year. So I can kind of take you from A to Z when it comes to Medicare. I have some clients who they want me to apply for Part A and B on Social Security for them. I have some that just want me on the phone with them so I can walk them through it. So I can be as hold your hand all the way, or just to kind of advise you on that first step of applying for Medicare Parts A and B. Because just because you're turning 65 does not automatically mean you'll be enrolled in Part B. So if you haven't, so the process is 3 months before your birth month, the month of, and 3 months after is when you can apply for Medicare Part A and B. So some get the card in the mail, some don't. If you are receiving Social Security monetary benefits before you turn 65, typically you're going to get the card automatically in the mail. I have some clients that I have, with my knowledge with insurance, under 65 and the Medicare age, I have a lot of clients who, we can get creative with how we do the insurance, and especially when we base it off with income, so we can kind of help navigate the future for when you do turn 65, so you're not having to pay a higher Part B premium. The extensive prescription drug and physician search is very important, and this is something that needs to be done on an annual basis because this can change annually. So the benefit year for Medicare plans is going to be January 1st through December 31st, and so that's going to change year in and year out, especially with a prescription drug. Formularies can change every year, and same with the medications that you're prescribed, and also the way that they tier these medications, whether it be generic, preferred brand, or non-preferred brand. Like I said, intake of the health needs and current and possible. This could be anywhere from, are you needing more dental for the next year? Do you need hearing aids? What brand of hearing aids do you need? That can depend on what plan we put you in. I work year round. Obviously, open enrollment is October 15th through December 7th. I work year round. Our office is right here in Lafayette, Colorado. I can do virtual, phone, and in-person appointments. I can come to you, or you can come to our office, whatever you prefer. And then the annual review of the current plan to review any new changes for the year, whether that be for the medical or the prescription. And then this is how you sign up for Medicare. Who is already 65 in the room? Okay, so you're familiar with this. So you can do one of three ways. Apply for Social Security at ssa.gov. It takes about 8 minutes. It's not difficult, but sometimes it can be a little tricky because you have to verify your identity. Sometimes that can be a little frustrating. Usually it's codes that are emailed or texted to your phone. So, if you get frustrated, don't worry about it. You can actually go to the office, whether walk-in or by appointment, or you can call Social Security, phone appointment, or call, and you can just wait on hold. And this is that piece I was telling you that I can help clients with if they want my assistance. And then step 2, after you've got A and B, which is what you're signing up for on the left, step 2 is you're going to find a Medicare supplement plan or a Medicare Advantage plan. Those are going to be your 2 paths to decide how you're going to fill in those gaps of Medicare. And this is when you can reach out to me, we can start the process, the research, and then, like I said, we can do it on the phone, virtual meetings, or in person. So this is a little video. I'm going to have you guys watch.
Hi there. Welcome to our guided tour of Medicare. When it comes to your health, what you want is simple: to feel the best you can as often as you can. So you want a plan that helps care for you every day in all sorts of ways, including your budget. That's why it helps to understand what kind of plan you need and how to make the most of it. We'll help you with everything you need to know about Medicare, what it covers, what options you have. So let's start with when you're eligible to enroll in Medicare. You're eligible if you are turning or have turned 65, even if you still work, or you're under 65 and have a qualifying disability or end-stage renal disease, and you're a U.S. citizen or a legal resident who's lived in the U.S. or Puerto Rico for at least 5 consecutive years. Maybe you're enrolling for the first time, like Susan. If so, the initial enrollment period, or IEP, begins 3 months before you turn 65 and ends 3 months after, which gives you 7 months to enroll. Susan's birthday is on the 1st of the month, so her enrollment period will begin and end a month earlier. Want to add, drop, or switch your Medicare coverage? You can do it during the annual election period, also known as AEP, October 15th through December 7th. Then there's the open enrollment period, or OEP, which runs January 1st through March 31st. If you already have a Medicare Advantage plan, you can change your plan during the OEP. James uses time to enroll in another Medicare Advantage plan, whereas Lisa decided to go back to original Medicare during open enrollment. You may only make one change within this period. Certain life events may qualify you for a special enrollment period, or SEP. These are times outside the other enrollment periods where you can enroll in, drop, or change your plan, depending on your eligibility. For example, Jeff recently lost the coverage he had through his employer this month, so he has 2 full months after the event to enroll through the special enrollment period. Specific dates vary for each person's situation. Now that you know when you may be eligible to enroll, let's lay out the 2 steps to help you get started with Medicare. Step 1 is to enroll in Original Medicare, offered by the federal government. Original Medicare includes Part A and Part B. Part A helps pay for hospital stays and inpatient care, while Part B helps pay for doctor visits and outpatient care. It may also help pay for services like occupational and physical therapy. However, Original Medicare doesn't cover everything. Benefits like long-term care, dental, vision, and hearing coverage, and most prescription drugs aren't included. Step 2 is determining if you need the additional coverage we just mentioned, and if enrolling in a plan through a private insurance company makes sense. When it comes to additional coverage, you have a couple of different options. Kim decided to enroll in Medicare Part C, also called a Medicare Advantage plan. With this plan, Kim will get everything Original Medicare covers, plus additional benefits. You can also get a Medicare Advantage plan that includes prescription drug coverage, known as a Medicare Advantage Prescription Drug, or MAPD, plan. For Michael, the best option was to keep his original Medicare and add prescription drug coverage, also called Part D. With Part D, each plan has a list of drugs it covers, called a formulary. Tier 1 covers preferred generic drugs. Tier 2 covers generic drugs. Tier 3 covers preferred brand name drugs. Tier 4 covers non-preferred drugs. And Tier 5 covers specialty drugs. Additionally, certain plans may offer a 6th tier. In most cases, the higher the tier, the higher your out-of-pocket cost will be. Please refer to the summary of benefits and coverage for more information. Most plans have 3 stages for covered Part D prescription drugs. Once Michael meets his deductible and reaches his out-of-pocket cap, his plan will pay the full cost of covered Part D drugs. If you want to add more than just drug coverage to Original Medicare, you can add a Medicare Supplement Insurance plan like Linda. Medicare Supplement plans can be added in addition to your drug coverage or by itself to Original Medicare. Linda chose to add this plan to help pay for her deductibles, co-pays, and other costs Original Medicare doesn't pay for. Lastly, there are 3 types of special needs plans that may be available to you depending on your area and whether you qualify. The first is the Dual Eligible Special Needs Plan, or DSNP, which is for those who qualify for Medicare and Medicaid, like Robert. These plans may have benefits that go above and beyond Robert's regular Medicaid coverage, such as enhanced care management. Next is the Chronic Condition Special Needs Plan, or CSNP. This is a plan that may offer added benefits for people with an eligible chronic condition, like diabetes or congestive heart failure. Finally, an Institutional Special Needs Plan, or ISNP, makes sense for Stephen, who requires institutional level care and has stayed over 90 days in a long-term care facility this year. If you think you may need help covering your drugs, you may qualify for Extra Help, also called the Low Income Subsidy. It's a government program to help people who qualify pay for their prescription drug costs. Now you're ready to look at plans. When you do, ask yourself a few questions, such as, how much will my annual premium be? My deductible? What about copays? Will I get drug coverage or other additional benefits? Which doctors, hospitals, and pharmacies can I go to? Does it offer convenience like prescriptions delivered by mail? Does the plan cover a chronic condition I have to manage? And finally, you'll want to consider what medical care you may need down the road. That's it. Now you know
Alright, so I like to always offer 2 different learning styles, like a video because some can learn better. Other than that, I'll go into much more further detail of what we just watched. Okay, so Part A is your hospital coverage. This is going to be anything inpatient, skilled nursing facility, and if you ever to go on hospice, whatever Medicare plan you were on, it will revert back, and then the hospice is paid under Part A, and then there's certain home health. So Part A is going to be 0 premium if you or your spouse has worked your 10 quarters in your life. If you have not worked those 10 quarters, the price range can vary from $278 to $505 a month, depending on how many quarters that you did work. So Part A has a deductible, $1,632, and it's per benefit period. So most people, when you think of a deductible, you think annual, right? So Part A is actually 61 days. So this is the reason why it's good that you need to have, why you want to pair original Medicare with something else to help cover these costs. So Part B is what they call for physicians. It's the outpatient care, doctors, physicians, oxygen could fall in here, some durable medical equipment, and then there's certain outpatient prescription drugs. There's certain injectables, and some chemotherapy and immunosuppressive. And this is gonna be, and that Part B, if you didn't know, Part B is income driven. So the income is gonna be based off 2 years prior. So whatever your income is, that's how you're gonna figure out how much you pay. So the starting price for 2024 is $174.70, and it's for income under 102,000 for single, under 206 if you're married. So Part B does have a deductible that is annual, and the annual deductible is $240. The thing with Part B is that it carries a 20% coinsurance with no cap. So the 20% coinsurance could be very pricey if you think about the cost of chemotherapy. You'd be paying 20% of the cost of that chemotherapy under Part B if you only had original Medicare. So IRMA is what drives that Part B income and why it varies. On this next screen, I hope it's clear enough. You'll see how as the income goes up, the premium goes up. So $174 on the top is the starting price. If you're married and income is greater than 206 and less than 258, you'll be paying $244.60 a month instead. And this will be per spouse. It's 258 to 322, you're looking at 349.40, and then it goes upwards from there. So it caps out at 594. And then these fees also, there's gonna be an additional premium on your Part B coverage as well. So if you do fall in these higher income levels, let's say you sold a home, and it bumped your income up, this is what you'd be looking at. I felt a handful of clients appeal this process, especially if it's out of the ordinary. I had a couple who lost a house in a fire, and the money they got from the insurance company actually bumped up their income. So they were getting maxed out this $594. They were able to send in the appeal form to Social Security and get them to give them the correct $174. So it's not unheard of to try. I would say out of every 10 people I advise on appealing this, about 90% of them get the answer that they're looking for.
Can you explain so if I sell my home, then the equity in the house is then, you have to go through the whole capital gains thing, but you're saying that's gonna, for a whole 2 years, isn't gonna increase the monthly cost?
It potentially could, and that's when you sell a house, that's something you could appeal. It's not your typical income.
Okay.
You could try appealing it, so, just see what they say.
Mm-hmm.
But it's worth a try, because it's a big difference in monthly premium.
Yeah, and how often do those appeals work?
Like I said, it's pretty common. I would say like 9 out of 10, my clients get the answer they're looking for.
Okay.
And they're, like extraordinary, like the fire, like they lost their house in the fire. So this is, I'm sure, what you've heard about all the changes for Medicare. So Part D is one of the big ones that is having a big adjustment for 2025. So this is all due to the Inflation Reduction Act. This has been going on for quite a while, since 2023. What they've been doing for the last 5 or so years, they have been trying to shrink what they used to be called as the donut hole. Is anyone familiar with that term? Okay, so the donut hole or the coverage gap is where Medicare beneficiaries, when they get their prescriptions, they go through these different stages. And what would happen in the middle is that the beneficiary would be required to pay a large chunk of that premium, that copay for that prescription. And it was very expensive. Some of these, in these past years, the out-of-pocket max on some of these drug cards was almost up to $7,000 a year. And then not everyone is affected by that. About 6% of beneficiaries were maxing out their Part D benefit because of how expensive their drugs were. So fast forward to today, in 2025, in January, it's going to have an out-of-pocket max of $2,000. This is going to help a lot of those Medicare beneficiaries that were really maxing out and having very expensive drugs, and they're having the insurance companies pay more, and then the max for the person is going to be the $2,000. The other unique thing is they're going to allow a monthly. You can actually pay for this monthly, so you don't have to. You're not going to max out that first month in January. You can elect to say, I want to just have equal payment every month. And that handout that I handed you, I'll go into, as we'll talk about that here in a second. So the deductible for 2025 is gonna be $590, and this is for the prescription. The initial coverage, and this is, I can't talk plan specifics because this is educational, but if you have specific questions later, I can go in more detail. After you've met the deductible, you'll pay 25% of the prescription costs, and this phase lasts until your out-of-pocket cost reaches $2,000. And then once you hit the catastrophic, you won't have to pay anything more for your covered drugs for the rest of the year, but they have to be covered drugs. So the coverage gap has been completely eliminated in 2025. And so this is a great change for Medicare. Okay, so if you wanna look at this. So this is gonna be it's a variable depending on the cost of your medications. If you wanted to start out doing those monthly payments in January, or if you wanted to start out in a different month, there's ways we can help. You know, everyone is eligible for this regardless of how expensive your medications are, but you just have to apply for the monthly payment.
Kelsey, so when you're talking about the monthly, you're talking about that 2,000 deductible?
Well, this sheet right here,
Oh.
so they can do that. $2,000 is the out-of-pocket max, but they can spread it out over the 12 months. Yeah, so if, say they were on a very expensive drug, they wanted to sign up from January 1, you'd be looking at like $166 a month. So there's ways to get around this and help, because Medicare prescription drugs, if you're familiar with it, throughout the year it's like this. So you have your deductible, then you have different stages. This is a way for them to have it be more streamlined because income is not changing, and so it's hard when the prescriptions are going like this. So this will be very helpful for those that were struggling, because a lot of the people that were affected by this, they couldn't afford the medicine.
Does that mean that the donor hole's gonna be gone?
Completely gone. Yes, completely gone. So your max is the 2,000.
When you say covered drugs, what is the definition of that?
That would be drugs that are under the formulary. So say you're getting vitamins that are not, those are not gonna be going towards it.
Okay, yeah, no.
Or say you're on a drug plan and the drug that you're prescribed is not on the formulary, that's not gonna go towards it either. So it has to be on the formulary of the drug plan you're on.
Okay.
And that's why it's so important to have that annual review to make sure you are gonna be on the correct plan. Do you have any questions about the monthly payment?
So I'm sorry, do you do annual reviews?
I do.
Okay.
Yeah, so the annual review looks like you get a list of your prescriptions, physicians, and then we can see if you're on the correct plan or if we need to switch you. It's very, very important for the prescription piece because every year that can change. Because the contract is just January 1 through December 31st. So if you stay on your current plan and let it roll over, potentially things could change and it might not be your plan anymore.
Well, the weird thing is my husband is still working and we have quote unquote good insurance coverage.
Oh, I'm sure it's a good employer, yeah.
Yeah. The prescription coverage is quote unquote really good.
No, it's not.
Costco pricing beats my coverage.
Oh, wow.
I had one drug that my insurance would charge me $70 for, and Costco's $19.
Yeah, that's a big difference.
So I'm like going,
Well, I always recommend whether you're on Medicare or Medicare coverage or under 65, shop around. I mean, you just because you have your insurance card, you go to Walgreens, Walmart, Costco, it can change, it varies. So I always shop around, and sometimes it's cheaper to pay cash. Like go to King Soopers and do the $4.
Yeah, same for me, I've got Blue Cross Blue Shield, a good RX oftentimes gives me better price
Exactly.
than my Blue Cross does.
Yep.
So-
exactly.
So it's worth doing. I mean, absolutely. And it sounds crazy that cash could be better.
Does everybody know they can use any pharmacy regardless of, like Costco is a membership club, but you don't have to be a member, correct, to use
Right.
their pharmacy.
Yeah, that's good to know.
Yep, you don't have to. And if they ask for your card at the door, you just say, I'm going to the pharmacy.
Yep.
They'll let you write in.
Yeah, that's good. I did not know that. That's good to know. So enrollment windows. This is where Medicare, this can help you avoid penalties, help you be on top of when you can change, when you enroll. So these are the enrollment periods. Some of these are set in stone, certain dates. The annual enrollment period is right now. So it's October 15th through December 7th of every year. And it will give you a January effective date is when you can change your Medicare Advantage plans, you can change your prescription Part B drug plans. Open enrollment is another period that a lot of people are unaware of. It runs from January 1 to March 31st, and it allows you to make a one-time change. So if you're on a Medicare Advantage plan and you're not happy with it, or say it doesn't have enough dental benefits, or you need a different brand of hearing aid, you can have a one-time switch to go to a different Medicare Advantage plan. It can also be used for someone who wants to revert back to original Medicare. Say we can push back that enrollment into Medicare by 3 months is the most we can do it, and we can save that person, quite a bit of money. Special election periods are going to be all throughout the year. Like Florida, for example, they'll be getting a FEMA special election period because of the hurricanes. Same in North Carolina. We had one earlier this year for a fire. Special election periods can also happen when you say you're retiring and you're coming off your group health plan and going onto Medicare. This is why you should review your plan during AEP, which is the annual enrollment period. Doctor hospital network changes. We've had a lot of that this year with the purchases of Intermountain and Common Spirit. It has been a mess. So it's very important to always double check because networks are not locked in. They can change all throughout the year. You never know. So it's always important and very, very needed to make sure you check this. Like we discussed, the prescription drug formulary changes. If your current medication has changed, you need more dental or vision, or say you're struggling financially and you want to look at some of these Medicare Advantage plans that give a Part B give back. Some of these reduce that Social Security for Part B by upwards of $130 right now. So some plans offer over-the-counter benefits. Some are better than the others. Some have better brands. This is another one that is very important. Some of these plans offer rides to and from doctor's visits or the pharmacy. Some offer more than others. Say copays are too high, premiums are too high. Starting in January of next year, depending if you have a Medicare supplement, they're going to have a huge rate increase starting in January. It could be either January or it would be when you got your supplement when you turn 65. We talked about this, who is eligible. The reasons why you would take advantage of this January 1st through March 31st OEP would be, say you missed annual enrollment period. You forgot to change your plan, not happy with your plan. Who can benefit is, you can kind of tailor this to your needs. So it's hard to pick your plan for the future. You have to make your decision at the end of 2024 for the entire year of 2025. This gives you a couple more months into 2025 if something has changed. And then you can be locked in for the plan for the remainder of the year.
And if people need long-term care, what point in time do they have to pick that? Do they have to pick that way up front or?
Typically, long-term care is typically picked when you're in your 40s and 50s because it's based off of health. So that's a big confusion with Medicare. People assume, but yet typical long-term health insurance is typically picked at like 40s,
right.
mid 40s because of the cost, because it has a monthly premium and it's based off of your health.
Oh, so that's not Medicare?
No.
Oh, okay, all right.
So this is the IEP, turning 65, receiving that 25th disability payment, or coming off employer health coverage. And I run into this all the time with this disability where a lot of people have no idea. They were considered disabled, but they weren't receiving the money. And they don't realize that once you've received that 25th payment, you can get early Medicare, which can be very helpful.
Can you say that again?
Once you've received your 25th disability check, you can get early Medicare.
Okay.
So, but you have to have that 25th check. So a lot of people don't know what's going on in the beginning, so they waste months. And it can allow them, because then once they can get on Medicare, we can control the costs.
Okay. Can you cover real quick how much Medicare pays towards assisted living and independent living?
How much they pay? None.
Yeah. Oh, yeah. So I just wanted to make, because everybody thinks that Medicare is gonna help pay for my assisted living or mine, and they don't.
And that's where she will come in to help advise.
And none of them are there's no special programs or anything, okay, just wanted to make sure.
These are all the different special election periods that you can take advantage all throughout the year. Left employer coverage, loss or change of Medicaid. You can change your Medicaid, Medicare dual plan anytime until November 30th of every year. This is a very, very underserved population, is the Medicaid and Medicare dual beneficiaries. A lot of these people have no idea what's out there. They just have original Medicare, they have Medicaid. I mean, they're missing out on food cards. There's so many ways we can help them financially, put food in their bellies. I mean, it's a very sad population because there's so many, and they have no idea what's out there. You moved out of your planned service area. So you're living in Adams County, you moved to Delta County. That would trigger a special election period because you're in a different county.
For how long of a period of time?
For which?
If you move, how long do you have?
Like 60 days.
Oh.
And then what 5-star enrollment means, and this is specifically talking about Medicare Advantage. Currently, right now, there's only one 5-star company in Colorado, it's Select Health. That is something that you can enroll in that plan any month throughout the year because they have been considered a 5 out of 5-star rating by their members. But like I discussed with, North Carolina and Florida, declared state of emergency would also be an SEP. You moved out of a facility, moved back to the United States, or released from jail, these will all trigger. Who's familiar with the penalties if you do not sign up for Medicare on time? So these are, the Part D penalty is minimal. So you do not have to take Medicare, but you will be penalized if you do not. And how this penalty works is it will follow you for the rest of your life. And they'll tack it on to your monthly premium, whether it be the B or the D, and you'll have to pay for it for as long as you have Medicare. The penalty on the drug card is 1% of the annualized premium added on to your Part D bill each month. You can only be without a drug card for 63 continuous days before this will start. The Part B penalty will be an additional 10% for each year you didn't sign up when you were supposed to sign up for Part B. And they'll tack this on to your Part B premium every month, forever. You cannot have active Medicare and receive premium tax credit through Connect for Health Marketplace at the same time.
What does that mean?
That means if you had insurance coverage, individual coverage, and you're under 65, through...
I'm over 65, so I don't understand how that last one, what that means.
You just can't have both. You can't have...
I have Medicare, but I don't know what tax credit Colorado Marketplace exchanges.
That would be if you were under 65.
Okay.
And you were just turning 65 and you're like double
Okay.
living.
Okay, thank you.
But you can have it for part year.
Yes, yep. You can have it up until you turn 65, or if your situation prompts, like what I said earlier, where we can kind of play with that 3-month window and push out the effective date, that's fine. It's if you went beyond that 3 months is where it becomes problematic.
I read online about the penalty. I don't know, because you can't believe everything you read online or in the paper, here on the radio station, that she did not enroll in it when she was supposed to in Medicare, and it's penalty, but when she turned full retirement age, she appealed it, so she didn't get the penalty. Is that true?
No, because true retirement age is different than Medicare. So Medicare is the medical piece, the true retirement would be the income piece. So she still has the penalty for not signing up for Part A and B, or B and D at the right time.
So if somebody misses it, they have to pay for the rest of
Yeah,
their
so if
life?
they miss signing up for the drug card on time, they're gonna pay 1% of the annualized premium, and it's gonna be tacked on each month for their Part D, prescription plan. And then the same with Part B, which is the physician piece. If they don't sign up for that, it's gonna be an additional 10% for each year they didn't add on.
For the rest of their life?
For the rest of life.
But if you have coverage, like employer coverage,
Right.
and you don't retire till you're 80,
You're fine.
you're fine. They
Yep.
don't, the penalty
You're totally
until.
fine. As
yeah.
long, the only catch with that one is on the prescription piece, is it has to be considered credible coverage.
Right.
Which most employer plans are considered credible coverage. So that's the only, extra piece of that.
Is there ever an appeal process that people could go through?
Not for not signing up on time? No. I mean, I would imagine if there was like the hurricanes going on right now, if you missed something, maybe, but not typically.
Okay.
Because the window is so big to sign up for Part B, 7 months. You know, the drug card's smaller, it's only 63 days.
Right.
But that would be harder to, and then there's different, and so if you miss your window and you don't sign up for Part B, you can only sign up at certain times throughout the year. You can't just decide, oh, I'm gonna do it next month, even though I turned 65 8 months ago. So there's certain times you can sign up for it.
If I live in Colorado for 6 months
Mhm.
and I go to Florida for 6 months, how is my coverage? Because in Colorado, there are some companies that are not in Florida. So do I have to switch my coverage?
No, because that's gonna be based off of where, like, Social Security thinks you live. So if you are a snowbird and you have 2 houses and you're going back and forth, we would just have to find a plan that works in both states. So Medicare supplement, you have it, as long as the doctor accepts Medicare, they accept the supplement, and you can take that, it's portable across the United States. Medicare Advantage plans are different. HMOs are gonna be wherever your home base is. So if you had a home-based HMO in Colorado, you're in Florida, You can go to urgent care or emergency room, but you couldn't see a physician or a specialty. If you had a home-based PPO Medicare Advantage plan, you could see like a primary care specialist in Florida, and you have urgent care and emergency room. So there is ways.
When you say Medicare supplement, is that also known as Medigap?
Yes, that's what it used to be called, Medicare.
Okay.
So that's like we used to have Plan F. Now we have Plan G. That's our Cadillac plan. And I'll go with that. So this is Medicare Advantage. So you can think of Medicare Advantage as an equation. So you have Part A, which is hospital. Part B, which is physician. Part D is drug, equals Part C, which is known as Medicare Advantage. What it does is it encompasses all of the pieces. And so you go from having, you have one card, which would be your Medicare Advantage card, which you use at the hospital, the doctor, or the pharmacy. And these are the things you're going to be hearing every end of the year, like around open enrollment, on the news, the radio, the commercials. This is what they're referring to, these Medicare Advantage plans, where they can lower your Part B, they have food cards, they have dental, vision, free gym memberships. So how these Medicare Advantage plans work is private insurance companies are managing your health care. And what they do is they are paid by the government between $400 and $1,000 each month to take care of you. These Medicare Advantage plans are the ones that have the Part B buyback. And what that means, some of these certain plans can lower that Part B premium from $174. They can lower it depending on how much that particular carrier's buyback is. Medicare Advantage must cover everything original Medicare covers. They typically are going to offer, their perks are going to outweigh, because they're going to give you dental, vision, hearing aid options. You're going to have access to free gym memberships. And majority of these plans have a 0 monthly premium. In addition to that Part B premium of the $174, you won't have to pay anything else for it. And most of the, go ahead.
Oh, I'm sorry. On the last slide, Part C, what is that again?
Medicare Advantage.
Advantage.
And that's exactly what this is.
Okay.
And most of these plans include your drug coverage. And it's included at no charge for you. All you'll have is your copays at the pharmacy. So Medicare Supplement. This is the one that's been around for a very, very long time. Medicare Advantage, I think they're about 13 years now, 14 years. So they're newer. Medicare Supplement have been around a lot longer. How Medicare Supplement works is you have your original Medicare. You have your Part A with a deductible of the $1,632. You have your Part B with a deductible of the $240, and you have the 20% coinsurance. The Medicare Supplement comes in and absorbs those copays, deductibles, and coinsurance, and then you have to pay a monthly premium. So in most cases for 2024, if you're female, it could be anywhere from $155 to $180 a month for this Medicare Supplement. And then your only out-of-pocket max would be $240, which is that Part B deductible. So let's say you're hospitalized. You're only going to pay that $240 for the rest of the year. Say you're hospitalized the month after, same thing, you pay nothing. These do not include drug coverage. So you have to add on the standalone drug card. Standalone drug card can range, there's plans this year that actually have a 0 premium, and it can go upwards of $140 a month. The price difference is dependent strictly on where you live and what medications you're on. So that's why it's so important to have the annual research, so we can plug it in. I do it on Medicare.gov, so it shows me all the carriers, and then it can tell me which plan is going to be the most financially suitable for you when we're looking at annual premium and copays.
But I have drug coverage on Advantage.
Yeah, you do. Medicare Advantage has it included. Medicare and Supplement, they're separate.
It's just separate from me. Okay.
Yeah, the drug coverage is built in. Most Advantage plans, where the standalone has to be paired up next to the supplement. Any questions? This is also a very important benefit for many, also very underserved. There's programs out there that can help. It's called low income subsidy. It can help pay copays for pharmacy, copays at the doctor. It can help pay your Part B premium, whether it be partial or full. There's so many programs, and if you have any question whether you could get access to this, you can call your county, you can call me, I can help advise. Or if you have, you can give this advice to any friends you think that may be struggling, because there's so many programs out there, and no one should ever feel any shame or, just take care of yourself.
Do you have to be a Colorado resident to talk to you?
I'm licensed in a handful of states, so I can advise on anything.
Okay.
Yeah, so even if I'm not licensed there, I can still, hey, this is what, or I can direct you to an agent in.
Okay.
So.
All right, great.
So this is the international travel I touched on in the beginning. This is good for all. I buy it for myself, Price-wise, so I have a family of four, I'm 44, husband's 44, kids are 12 and, how old are they? 14 and 12.
I don't know, how old are they? They're 6 and 8.
There you go. There you go. And so I think it was like $80 for 10 days in Mexico. It's very, very inexpensive. My dad is 68. His was, for the same 10 days, was I think like 110. It's based on age, and so it's still $110 for an additional $1 million of coverage. Very important. Because Medicare will only pay up to $50,000 lifetime for anything in international anything international medical. They do not cover medical evacuation or assistance in navigating foreign health systems. I like this because if something were to occur, I can just call an 1-800 number, and it's like a medical concierge, and they will communicate with wherever we are. They will communicate with the hospital in the correct language. I'm not having to hand over a credit card. Very, very beneficial for all ages, not just Medicare. But Medicare is important to know that it is a max of 50,000.
And do you have to let them know like every time you travel, or how does
Yeah,
that
there's
work?
different ways. Like say if you're a huge traveler, you can get like a year pass, or you can just do each one.
Okay.
That year pass was pretty reasonable, wasn't it? You told me.
Very, yeah, so my
Like
family,
300 or something?
well, my dad was 110, I think.
Yeah.
I did a couple that were going to, for about 30 days, they were going to Ireland. Theirs is about 320, but it was 30 days. But still, that's $320 for the month. Not bad.
Yeah, and I just had a client that her husband had a stroke while scuba diving in Mexico.
Oh, wow.
They had none of this insurance, and it cost over $100,000 just to airlift him back here. So
Oh,
she's
yeah.
72 years old, and she was starting her new job that day because of all this debt
It's
from travel.
scary. There was an article on Apple, maybe about a couple months ago. It was talking about a gentleman who decided to forego Part B because he didn't want to pay for it. He was airlifted from wherever he was, and the bill was astronomical because he has to pay that 20% co-insurance for the Part B. So, do you have any questions? I know I went over a lot, and I know I can talk fast. I hope any questions?
When I signed up for Medicare, there was something that you only had 6 months to sign up and you never can get that again. What was that?
So you have 6 months to sign up for Part B.
Oh,
And then you have, actually, it's your 6-month guaranteed issue to get a Medicare supplement. So if you, within those first 6 months of when your Part B is activated, whether you turn 65 or you retire, you have 6 months to get on a Medicare supplement, or they can ask you medical questions. And then they can either deny you or rate you up.
and so that, I think that was the key. It's like, so if you have some medical issues and you're just turning 65 to sign up, you should do that.
Yeah.
Because then you don't have to answer a question.
Yep. And say, there's another caveat.
Okay, I knew it was something that I thought was important, but
Now, again, 65, but if you're not working,
yeah.
If you're covered under your spouse, or you're totally fine. So whenever your spouse decides to retire, that's when you'll come on and you'll start the process for Medicare. And there's a whole process when you're over 65 and working, where you just have Part A, and then I can assist with getting you set up for Part B and getting that activated, because how it works is your employer fills out a form and says, yes, you've had credible coverage, and then it waives all the fees, it waives all the penalties, and then it gives you that same guaranteed issue once that Part B is effective. And one other piece I forgot to say earlier was, if you are on COBRA and you turn 65, that is not gonna give you the same eligibility window of that Part B, because it doesn't count. So only keep employer coverage if you're actually employed.
So the first couple of years I was just on regular Medicare. I had A, B, D, and N.
That's a Medicare supplement. So you had Part A, Part B, your Medicare supplement was the N, and the Part D was your drug card.
Okay. How's the supplement different from B?
Well, the supplement comes in and helps pay for B. B is just that's going to be the physician where your deductible is $240 and your co-insurance is 20%. That supplement of N comes in and helps pay some of those bills under B.
It's freaking useless then.
N is not the greatest plan. Yeah. So if you had Plan G with a supplement, so your same scenario, you had A, B, G, and D. That G, your only exposure financially would be $240 for the entire year. So you say you had $1 million hospital bill, you're only paying $240.
Yeah, I think I just paid in the end and it was a big sucking hole.
Yeah, so some of the supplements they're not all created equal at all. So by design, they're all the same. They just vary by carrier, but there's different letters that, you know, G is the one, if you're gonna get a supplement, G is the one you want because it absorbs that 20% coinsurance in Part B. That's why it's so important. That's where the Part B is where you have, you know, airlift, you're gonna have, some certain drugs, like the chemo drugs or the immunosuppressant. That's where that 20% is then absorbed and paid for by that supplement. So that's considered like the Cadillac supplement plan.
And how much is G?
G is age-based and zip code based. So for someone turning 65 in this general area, it can range 140 to 175
A month.
a month.
And I just want to mention too, Kelsey's helping a client of mine who is moving from Illinois to Colorado. And we have to time everything just perfectly, so when she gets here to long-term care, that she has her coverage. So it's those little things that sometimes we don't think about, oh, we're just gonna move. Well, you've got to make some changes when you do that.
I have a question. I can remember, so that if you turn 65 and you take a supplement, can you switch to an Advantage any time later on?
Yeah, so.
Or the other way around?
Other way
Because I
around.
remember hearing
Yeah.
that was a problem at one point.
Yeah, other way around. So say you are on the fence, you don't know what to do. Do I take a supplement? Do I take a Medicare Advantage? I have this happen a lot with my clients. They're healthy. They're like, I don't want to spend the supplement right now. So there's a 12-month free look period. So how it works is when you turn 65 or activate the Part B, you can take a Medicare Advantage for that first year for 12 months. And any time within those 12 months, you can revert back to a Medicare supplement, guaranteed issue, no medical questions. So how it does is it extends that 6-month window and it turns it into 12 months so that you can either save that money for that first year and then still have that safety net of supplement if that's what's important to you. Some people, it's the supplement is vital. That's what they want. They don't want anything else. Other people, they want to save the money. They want the extra dental benefits. It's very individualistic of what's important to you and what your needs are. And so, and like if you ever wanted access to Mayo Clinic, you need to be on a supplement. The Medicare Advantage will not suffice.
But that supplement, some of the supplements have no monthly fee.
That's the Medicare Advantage.
Okay, yeah. And then, even if you do go to Mayo, they have a sheet when you go in there that here's what your Medicare pays and here's what we're charging more than Medicare. Yeah. So you're not getting in there without paying.
Oh, you're gonna be paying,
Yeah.
regardless. Absolutely.
Okay, so, one quick comment is, you know, that when Spirit or whatever, Common Spirit, when they, you know, bought whatever, which included health images, when they didn't add, anyway, they weren't willing to pay the Blue Cross Blue Shield price, so they didn't, and then the government, Blue Cross Blue Shield, and then they realized how many, in Colorado, how many clients they were gonna lose, because in Colorado, that were Blue Cross Blue Shield were leaving, they renegotiated with Blue Cross Blue Shield and made it retroactive. Because I had images at Health One Images at the time when the appointment was set, it was covered. Then I had the scan, it wasn't, I got the bill from Blue Cross Blue Shield, it was 800 and something. But then Blue Cross Blue Shield said, no, they came back after they realized how many government patients in Colorado they were losing as patients, that they renegotiated the contract and made it retroactive. Yeah, and so it was taken care of. But that's where I'm confused, is I have Medicare, I'm a retired federal employee, so I do Blue Cross Blue Shield federal. So I have no copays on anything. That's still the best coverage for me.
Yeah, don't ever get off that.
Okay, but then I'm still confused under the, because they changed the prescription coverage, so I don't know if that's still.
Well, we can set a time and I can talk and I can say, because you never want to lose the supplement that you have through the federal government.
Okay,
The drug card, I just need to see what it is and then I can.
Okay, thank you. Okay, I feel better. And I was going on, I was getting really good.
Oh, no, you're fine.
Okay, thank you.
If you have insurance from a private company, like say she has for the federal government, can you also get Part B? And if you can get Part B as well, who would pick up the cost first? Would it be private or Part B?
So Part B is the price you pay to Social Security. So that's paid by you to the government to have access to Medicare. And so that is going to be paid regardless whether you have an Advantage plan or a supplement add-on plan. You have to pay that $174 no matter what. unless you qualify for Medicare, Medicaid, or some of these, low-income subsidies. What do you if you wanna talk after, I can see what you currently have and I can help you. I can explain it.
I have United Healthcare.
Do you have like a, Medicare Advantage, or is it the?
Yes, yes.
Okay,
or
so you have the Medicare Advantage plan, so you have the A, the B, you already have the B,
Yes.
and you have the D, and then that equals the Medicare Advantage plan.
But I can also enroll in my, federal health plan too.
Do you have access to that as well?
Yes.
Okay, if
And
you,
so my, question is, would, if say I had to go to the hospital, who would pay first? Would it be the federal plan or the,
are you
or
currently enrolled in both at the moment?
No, but, I have the option to.
I would imagine the federal one would be better than the Medicare Advantage, but again, I can look at your scenario.
Thank you
And
so
I can let you
much.
know.
Thank you.
And why do they, every time I go to UC Health, they make me confirm that I don't have a spouse, I've never been married, I don't have a spouse, I'm not a
It's just
widow.
those demographic questions.
It's just
They're
like that
getting
every
worse.
time.
Yeah.
I go, why can't you save it in there? And they go,
Yeah.
that we're required to ask it every
Yeah.
single time.
And she refused to answer those?
I
No.
mean, I don't,
No?
Well, not anymore at UC Health, because I was to the point of, anyway, and then the last time I checked in at UC Health, then they say, well, then they don't let you come in for the appointment. That they're required to ask them, it's in my file, it's in my record, I'm 71, it's been in my record since I was turned 65. And so I don't know why they still make you answer those stupid questions every single day. And if you walk into UC Health primary care, and then I have to go over to UC Health for tests, I have to do it all, even on the same day. You still have to, then you go to lab work, then you go to x-ray, each one makes you answer those questions. And I was in a bitchy mood one day, and I said, I'm not answering that anymore. I've answered it five times today, I'm not, well, then you can't do the test, because I'm refusing to answer the questions. Yeah, I was in a really bitchy mood one day, and just said, I'm done, just stop it, Anyway, so that's UC Health, so I don't know about it.
What you do is you type up a list and you say, have you been married? No, and all the answers, and then just hand it to
I'll do that.
And put it laminated,
Yeah.
so that it doesn't get all grimy.
I'll do that, thank you. I hadn't thought about that, because this just gets so annoying.
And they'll probably not wanna read it, and you can say, listen, I'm tired, I can't talk anymore today, here's your answers.
thank you so much.
Yeah, thanks, everyone.
My card's back there if you have any questions.
Thank you.
Thank you.
Again, thanks for being here. Join us November 13th. Again, we'll have a therapist that is going to talk about stress and grieving around the holidays. And we all have stress around the holidays, so lots of good tips for that. So.
And then party in December.
In December, we're going to have a Christmas party, so watch for that too.
You're
So,
at the library?
yes,
Oh,
yeah, right here.
Thank
Yeah.
you so much.
Yes.
Thank you.
Thanks for coming.
Thank you. You're welcome.
I'm not, well, I can go in and out if I was married to a spouse for 20 and out, but it's just me, and I was a federal employee, that if I leave under the federal health system, I cannot come back to the service. I'm a retired federal employee, but if I choose to move out, like, I can't go back. Yeah, make sure. I know that if your spouse, and your spouse moves around, and they don't they're working and you're required to live that's why when I